Hi, my name is Dr. Keith Lewis, and thank you for requesting my free thyroid report. You'll be receiving your free report very shortly. But first, I'd like to just tell you a little bit about me, and also tell you about a special offer we have for you for requesting that report. As I said, my name is Dr. Keith Lewis. I've been in practice for 27 years. My original training was in chiropractic. I'm a chiropractic physician. In 1998, my practice changed a bit in that I started treating patients that had more functional type problems. And what I mean by functional problems would be more concerning those that may be experiencing symptoms or signs of thyroid, just like you, or diabetes, or heart disease, or high blood pressure, or digestive problems. We use a functional diagnostic medicine model to evaluate our patients. And what that basically means is that we look for imbalances within your body. We look for biochemical imbalances, or physiological imbalances, hormonal imbalances. Sometimes something as simple as dietary imbalances can cause a whole host of different conditions or symptoms you may be experiencing. So our approach is more of a whole body, whole person type of an approach towards care. Not treating a disease or a condition or a symptom, but treating a person, a human being, a patient. So it's very, very customized towards the individual, and that individual that happens to become our patient. I do have a board certification in anti-aging medicine, a board certification in integrative medicine. I have a diplomate in pain management, and a fellow in integrative medicine. So I have a very diverse background in the treatment of these very complicated, complex type conditions that many patients present with. As far as our special offer is concerned, our initial evaluation process costs $195. It involves 2 visits. The first visit, we sit down knee to knee, and you get to meet with me. But we sit down knee to knee, we do a thorough history, and I want to hear your story. I want to hear what you've been through with this journey of yours, managing your way through a low-functioning thyroid problem. We also do a physical examination, primarily focused on the thyroid gland. And if you have any medical records, bring them in. I mean, I don't care if they're 2 weeks old or 2 years old. Anything that you have, help complete this diagnostic picture as to what's happening with you. So the more information I have, the more I can help. So you bring that in, and on visit number 2, we sit down again, knee to knee, and we review your physical examination findings, we review your history, and I review any laboratory work that you've had performed. And at that point, I think I can give you a fairly good opinion as to whether or not I think you've had the proper diagnostic workup, and whether or not any further diagnostic evaluation might be necessary. Throughout that whole process as well, I think you'll get a much better understanding about what our approach is towards your care. Because our approach isn't about treating symptoms. Our approach is about fixing or correcting the cause of the problem. Using vitamins or minerals or homeopathics just to treat symptoms, to me, is no better really than using medication. But using homeopathic supplements, vitamins, minerals, herbs, and whatever to improve function makes all the sense in the world. So again, we're treating function, identifying areas of dysfunction, not treating and focusing on symptoms. So if you'd like to take advantage of this free offer, well, I shouldn't say it's a free offer, it certainly is a discounted offer, but for $95 instead of the usual $195, you can come in, we'll go through 2 different visits, and at the end of that second visit, I'm sure you'll find that our approach is certainly different, and we'll find out at that point if it's a good fit for you in terms of pursuing your good health. So again, thanks for watching this video. Oh, by the way, make sure you fill out the information on this page so that we can contact you for these 2 visits for $95. So again, thanks for watching. This is Dr. Keith Lewis.